Guys, in anti-ulcer therapy, okay, that is you're trying to treat peptic ulcers, the main thing they have asked for you is this one, proton pump inhibitors. Omeprazole, Esomeprazole, Lansoprazole, Pantoprazole, Rabiprazole, Dexrabiprazole. It's not difficult. So let us dive into this proton pump inhibitors. What do they exactly do? What do they exactly do, guys? They reduce the gastric acid secretion. Okay? That's what we want, right? Reduce the gastric acid secretion. So let's look at this now. Proton pump inhibitors, omeprazole, Esomeprazole, Lansoprazole. All these prazoles are interesting, right? So you can remember the names easily. Lansoprazole, Pantoprazole, Rabiprazole, Dexrabiprazole. Prazole is common. So first of all, remember the names of the drugs: omeprazole, Esomeprazole, Lansoprazole, Pantoprazole, Rabiprazole and Dexrabiprazole. Okay? These are what? Proton pump inhibitors. They will stop the secretion of acid. That's what we want, correct? Let's dive into this. Now, omeprazole is the prototype of this group. It can be given as oral tablets, but they'll be enteric coated, remember? So the person should not break it, right, and have it, because it is enteric coated. It has to escape the gastric acid and it has to reach the intestine, get absorbed and then work. Okay, so it is enteric coated tablets that they get. Main thing here, we have to focus on the mechanism of action. Okay, you see this red circle here, right? This is the hydrogen potassium ATPase enzyme. Okay, this will be inactivated irreversibly by these this omeprazole. Okay, so let us go and add the details that we know. It is an enteric coated tablet. Should not powder it. It is given by oral route. Okay, it is a enteric coated tablet. Oral route, should not be powdered. Okay, then what else? It is a inhibitor of the final step of gastric acid secretion. These are actually preferred drugs for peptic ulcers. How exactly they work? They are going to inhibit this hydrogen potassium ATPase enzyme, irreversibly inhibit. So they are going to irreversibly inhibit H plus K plus ATPase enzyme. Okay, and it inactivates it irreversibly. I told you that. How exactly it happens, I will tell you. See, what happens is, it will get absorbed in the intestine, correct? Then it will reach the parietal cell. In the parietal cell, the pH will be less than 5. In this acidic pH, it rearranges itself into two charged cationic forms, sulfonic acid and sulfonamide. Now, these what they do, they react covalently with sulfhydryl groups, okay, of H plus K plus ATPase enzyme. So, covalently means what? It will become irreversible, correct? You understood, right? So, the enzyme will not be able to work and the acid cannot get released. See this? This enzyme is stopped. So, H plus can't be released to the lumen. So, if the body wants something, now it has to make new H plus K plus ATPase enzymes, okay. So, the gastric acid secretion will resume only when new H plus K plus ATPase molecules are synthesized, okay. Only when new H plus K plus ATPase molecules are synthesized, the gastric acid secretion can resume. Pretty clear, right? So this is the mechanism of action. You will have to write this. Okay. Remaining part of this omeprazole is omeprazole is very similar. It is metabolized in liver. Metabolites are removed by kidney in form of urine. It is highly plasma bound. All these are usually common. There will nothing be new. If there's something new only, you will have to remember. Otherwise, for all drugs, you'll write the same thing, correct? Time to move on to Esomeprazole. Esomeprazole. What is new about Esomeprazole? It's an enantiomer of omeprazole. It's an enantiomer of omeprazole. It is having higher oral bioavailability. Higher bioavailability. They produce better control of intragastric pH. Okay. So they are better for GERD, that is gastroesophageal reflux disease. Okay, they are better for gastroesophageal reflux disease. And what else? I think that's enough. Let's move on to the next one here. Lansoprazole. See, if you want more information, you'll have to refer the textbook, okay? Lansoprazole, somewhat more potent, okay? More potent than omeprazole. This is partly reversible inhibition of H plus K plus ATPase enzyme. So it is doing what? Partial reversible inhibition of H plus K plus, higher bioavailability, faster onset of action, slightly longer T half. I'm not going into the details. Same thing, okay? It is, all these are better. Higher oral bioavailability. Okay, we're moving on, guys. Next one. Pantoprazole. Pantoprazole. This has higher bioavailability, oral bioavailability, but extra here is available for IV administration also. Okay. And bleeding peptic ulcer and for stress ulcer it will be good. Okay. Then you have rabiprazole and dexrabiprazole. Let's look at them. Rabiprazole and dexrabiprazole. Rabiprazole is a newer PPI, okay? It's a newer proton pump inhibitor. So don't wonder if somebody says what PPI is. Proton pump inhibitor, okay? PPI means proton pump inhibitor. These are all in newer, but they are similar to omeprazole, nothing much different, okay? Let us go to the uses of proton pump inhibitors. You will use them to treat peptic ulcer, bleeding peptic ulcer, to treat stress ulcers, to treat GERD, that is gastroesophageal reflux disease. Then you will use it to treat Zollinger-Ellison syndrome, which is a tumor, right? So if there is excess secretion of gastric acid, you can put omeprazole and they will inhibit the gastric secretion in the final step. So there will be absolutely no gastric secretion. Then for treating aspiration pneumonia, to prevent aspiration pneumonia. So basically aspiration pneumonia means what? The acid in the stomach can get into the lungs, okay? So to prevent that, you will use, make sure that the acid is not at all secreted. This you can do before surgery or something, because the person in normal state you will not have aspirational pneumonia, but in surgeries etc. Okay, it is possible. So prevent aspirational pneumonia, so you will give it pre-operatively. Okay, you have to give it pre-operatively. Fine, shall we move on? Let's move on to the adverse effects of PPIs. Luckily, not much of side effects are there. They produce minimal side effects. Side effects mentioned are nausea, headache, abdominal pain, rashes or hypersensitivity. I told you to write for everything, right? Dizziness. You can put that next there. Muscle pain, joint pain, atrophic gastritis. These are all prolonged treatment only. Okay. Lot of other things you can read the textbook for them. Okay. So let us revise what we have studied in this video. In this video, we started off with proton pump inhibitors. Okay. Proton pump inhibitors are omeprazole, esomeprazole, lansoprazole, pantoprazole, rabeprazole and dextrabeprazole. These are given actually as enteric coated tablets. They block the last step of the acid secretion. So it doesn't even matter whether there is histamine, etc., etc., because the last step, which is common to everything, right? That step is blocked. So everything else, histamine, gastrin, all this, they don't matter at all. Okay. Even the thought of food will not release the acid in this case. Can you see that? They are given in oral route. They are enteric coated tablets. They should not be powdered or broken. Inhibitor of final step, I told you, right? So even the thought of food cannot release acid. They have taken over even H2 blockers. They are preferred over H2 blockers also. So it irreversibly inhibits this K plus ATPase enzyme, and when the body resynthesizes this enzyme, only then the acid secretion can resume. Okay. So how exactly omeprazole acts? Exactly how it acts? It rearranges into two forms, sulfenic acid and sulfonamide. You should remember these words: sulfenic acid, sulfonamide. Okay. And these, they react covalently with the sulfhydryl groups on H plus K plus ATPase enzyme. So what happens? Covalently means it is irreversibly bound. So it will be inhibiting these enzymes permanently. The body will have to make newer enzymes. Moving on to esomeprazole, it is an enantiomer. It has higher bioavailability, preferred in gastroesophageal reflux disease. Lansoprazole, just remember, it can partly reversible inhibition. It's kind of reversible inhibition of this enzyme. Pantoprazole, available for IV administration. Rabeprazole, dextrabeprazole, they are newer. Uses of proton pump inhibitors: peptic ulcer, bleeding peptic ulcer, stress ulcer, gastroesophageal reflux disease, Zollinger-Ellison syndrome. Prevent aspiration pneumonia. Preoperatively, or when there is prolonged anesthetic, they can give this. Adverse effects: nausea, headache, abdominal pain, dizziness, rashes. Prolonged treatment can lead to atrophic gastritis. Okay, so I think that's all we wanted to cover in this video, correct? See you, bye bye.